this talk was really to give a sort of general introduction to poultry welfare assessments. So Dr. Dixon gave some really lovely, more detailed examples of some issues that I will be covering. So what is a welfare assessment? It's really an attempt to measure an animal's experience and its ability to cope with its environment. This is really important to understand, that it's really the experience and the ability to cope. So welfare assessments are really an individual measure. With poultry, we often talk about flock welfare, because we generally deal with flocks rather than individuals. But welfare is really an individual experience. So every animal within a particular barn could be experiencing something differently. And so having that understanding that the experience is important. And so what we measure is really about trying to access what that experience is and how that animal is able to cope with its environment. So when we talk about environment, we're talking about a lot of different things that can be considered part of an animal's environment. So there's the physical environment. So that's directly what is in the animal's environment. So bedding, if you're in an aviary system for laying hens, it's the physical structures within that barn, any type of enrichment, physical enrichment that you might have in there. There's also a social environment. And so that deals with the animal's perceptions and interactions with other individuals within that flock. We have emotional environment. So is there suffering going on? Are they experiencing pain? Cognitive environment. Are the animals able to utilize all of their sort of cognitive functions that they're set up with from a sort of evolutionary perspective? And obviously, as you can guess, some of these aspects are much easier to measure than others. So we can easily measure, as Dr. Dixon pointed out, physical structures. We can look at behavior to try to have a better understanding of the social environment of the birds. How are they interacting with each other? But the emotional and cognitive issues become much more difficult because we don't really have tools to be able to ask animals about these sorts of experiences that they're having. But we oftentimes focus when we talk about welfare on these emotional or cognitive abilities. And so an example I have is a marketing campaign from a few years ago in California, which some of you may have heard. Happy cows come from California. But what does that actually mean? How do we know that those animals are happy? And that's a really difficult question to answer, but we oftentimes will talk about welfare in terms of the animal suffering or the animal's happy or the animal's thriving. And so how do we actually measure that? When you do an animal welfare assessment, you have sort of three possible outcomes. So an animal is either in positive welfare, which we might say is thriving, the animal's thriving in its environment. You could have a neutral outcome, so nothing really bad with the animal, but you don't really have any indication that there's positive welfare, and so we would just sort of say that those animals are existing. And then we can have a debate about what does existing mean for an animal. And then we have negative outcomes, which would include measures that show that an animal is perhaps suffering in some way. And historically, as Dr. Dixon pointed out, we have measured welfare. And so we have a lot of measures that we can use to try to get us a better understanding of if an animal is suffering. And if it is, we can then try to provide interventions to move it up to neutral. And we're just now starting to really focus on that positive. How do we know that an animal's in a positive state of welfare? So how do we actually measure these? There's two major types of measures that we use in welfare assessments. And so historically, the sort of easiest types of measures are these resource and management-based measures. And most of the welfare certification companies have historically used these types of measures. Because we have some scientific evidence about correlations between things like stocking density and welfare outcomes. but they're also fairly easy to measure. They tend to be very objective. They tend to be highly repeatable. And so you can really compare within a barn and across barns with these types of measures looking at welfare outcomes. So these are measures that are commonly taken, things like stocking density, feeder space allowance for space. Management-based measures might be more something like litter quality, ammonia levels, light levels within a barn. And then we can use those to sort of guess what the welfare state of the animals in those are. The problem with these measures is that they may not correlate directly with an animal's experience. So the correlations that we do have are oftentimes sort of loose correlations, or we don't have a lot of good data on some of these measures to really tell us that if for instance, litter quality is good, you're going to have good welfare outcomes. The other type of measure are animal-based measures. So these are things, and Dr. Dixon gave some really good examples of these. Presence of disease, behavior. What are the birds actually doing? Are they doing things that are bad? Are they doing things that are good? Lameness levels, particularly with broiler chicken and turkeys. And then we can also look at physical condition of the birds. That's how are they coping with their environment? Are they really dirty? Do they have wounds? That sort of thing. These are really good measures, and that they measure the animal directly. So you're actually looking at the animal and you're seeing how are they interacting with their environment. And so they tend to be a better indicator of welfare. The problem with these measures is that they're very difficult. They can be very difficult to record. So when you walk into a barn of, let's say, broiler chickens, and you want to look at a particular individual, that may be really difficult to do because they're sort of in a sea of white birds that they can blend in very easily. And maybe you can't see some parts of the bird. They tend to be very time consuming. So you have to go through a facility and you have to look at individual animals to take these types of measures. If you're doing behavior sampling, you need a certain amount of time to be able to watch the behavior and analyze that. And they can also be very subjective. So behavior sampling, for example, requires some fair amount of training. You can have two people look at an animal and determine that it's doing different things. Or maybe just from one vantage point, you can't really see what the animal's actually doing. And then Dr. Dixon gave a really good example with the gait scoring about it being a subjective measure and the training that's required to do that. So these can take a fair amount of time while you're actually performing the measure, but there may be some substantial time beforehand in terms of training. So I wanted to give you an example that sort of looks at both of these measures. And we're going to look at stocking density. So stocking density has been considered a welfare issue for a very long time. And the way that we typically measure stocking density in terms of a welfare outcome is a threshold number. But when you look at the literature, there's no real clear critical stocking density. So where is that threshold where stocking density starts to become negative in terms of welfare outcomes? No one has found that yet. And so people have looked at really large ranges of stocking densities, and there's been a lot of conflicting results. So some studies with low stocking densities have found poor welfare outcomes. Some studies with high stocking densities have found good welfare outcomes, and then you have everything in between. So it's really difficult to sort of say from a scientific perspective, what is the best stocking density? And one of the reasons why this has proven to be very complex is that the results are strongly affected by temperature, humidity, litter moisture, and some of these things can be really difficult to control. And some of that has to do with the behavior of the birds, right? We know that birds like to be near each other, they like to clump. And so even if you have an overall stocking density for particular barn, you may actually have micro stocking densities within that barn. So you may have places within that barn where there's a large clump of birds. And so you may see exacerbated welfare outcomes. Maybe they have more footpad dermatitis, birds that are hanging out in that area because the litter is wetter, just because there's more birds there. So there's more manure in that area, higher levels of ammonia in that particular area. And you may have other areas in the barn that are not as crowded. And so you don't see those types of problems in birds that hang out in those types of areas. The other issue with stocking density is that a lot of these studies have been done on university facilities, which are great. So I use university facilities. Sometimes that's all we have access to, but don't always relate to commercial scale. And stocking density is one of those types of measures that's really important to look at on a commercial scale. And that's really because there are a lot of factors that we can't replicate on a research facility that exists on a commercial scale. So we don't really have the ability to sort of transfer a lot of that knowledge in terms of what is a good stocking density or not. And this is a really good example of, you can take this as a resource-based measure. So you can look at a particular stocking density or manage a particular stocking density, but it's also really important to look at some of these animal-based measures to really understand what's going on in that environment. Are you able to manage a particular stocking density at a really high level with very good management, and so you see very few negative welfare outcomes, or are you somewhere in between that? So some of the animal-based measures that we can take to look at things like stocking density would be things like lameness. So how easily can the birds move around? Are they able to be active? Can they build up some strength in their legs? We can look at foot condition. So is there something going on with litter condition that might be influenced by stocking density? We can look at fear levels. So there's some indication that higher levels of higher stocking densities of birds that have higher levels of fear. We can look at stress indicators, and then we can also look at mortalities and culls. So how bad is the situation? There's some trends that show that higher stocking densities might increase mortality, for example. Or you could look at culls to get an idea of, do you have a lot of leg issues? And then all of these measures can be compared with each other at any particular density. So you can look across densities using these measures to try to get an understanding of where does the welfare fall in terms of stocking density. So one of the main ways that we measure poultry welfare now, I would say, is probably using the Welfare Quality Assessment Protocol for poultry. This is a system that combines the different types of welfare measures. So it uses both resource and animal-based measures. All of the measures within this system, this was developed in Europe. They're all based on validated, repeatable measures. And so they should work fairly easily. There are some measures that are subjective and need some training. But for the most part, you can pull out measures that you perhaps don't need as much training for. It really provides a tool to assess welfare in relation to management. So it really takes into consideration measures that look at welfare outcomes that might be related to management practices. And it really has become a sort of standardized tool that's been adopted, particularly by researchers in North America as well. So despite the fact that there are some subjective measures, there are some measures that require some training, it is a more objective type of study assessment that we can use, particularly for research, that will allow us to compare across different studies. Oftentimes, though, if you do a welfare quality assessment, it's very lengthy. It can take hours to go through and do this type of assessment if you're following the full assessment protocol. So what typically happens with research is that we pull out pieces that are most important to the questions we're asking. And also, if you're a manager of birds, you can do the same thing. You can pull out pieces of this that make sense to what you're trying to measure. So you may not want to do some of the behavioral measures because those are rather time consuming. And maybe you want to focus more on body condition type, which are a little bit easier to go through. So one of the issues with welfare quality, the welfare quality assessment system, is that it's not widely used on a commercial scale, particularly in North America. Again, we tend to pick out pieces, and we don't really look at the overall assessment that is laid forth within the document. As I said, some measures are subjective, although there is an attempt to make them slightly less subjective. Some measures need explicit training. And so Dr. Dixon talked about keel bone issues. So I also have that as an example of a measure that really needs some fairly good explicit training, or it also represents a measure that when the welfare assessment was developed was the best we had, but we're now starting to get better types of measures. So if you look at keel bone deformities or keel bone fractures, for example, the way that you measure this in the welfare quality system is through the palpation method, and Dr. Dixon explained how that works. However, studies have found that rarely are palpation results correlated to postmortem exams. And again, you have to be really, really well trained to have that sort of high correlation. And a lot of folks aren't. And the type of training that you get varies by where you are or what your experiences have been. We see a very high rate of false negatives. So oftentimes people say there's no issue when there actually is if you dissect out the bone. So training is really essential. But work that I've done in my lab has actually shown that training may not have as much of an impact in terms of improving palpation results as we sort of thought it might. So with palpation, there's really poor intra and inter-rater reliability. And so those are just terms that mean when you're doing it yourself, so that's intra, if you repeat a measure on the same bird, there's very low repeatability. So you might think that you found something one time and then you say there's nothing wrong with it the next time. And that same goes with between different raters. And we've actually looked at trained, so folks who have palpated thousands of birds, folks that have palpated very few number of birds, so relatively untrained individuals. And we actually found that at all levels of training, there was this poor intra and inter-rater reliability. So palpation is not really a very good method in terms of trying to understand keel bone issues. There are now better technologies in terms of portable X-ray machines, for example, that are expensive to buy, but they're very easy to use, and you get digital images immediately. And so those seem to be a much better way going forward to try to measure some of these issues. So where do we go from here? What's the future of welfare assessment? One of the things that we have yet to sort of figure out is sampling, particularly on a commercial scale. We really need to work on developing standardized sampling schemes. So Dr. Dixon was absolutely correct when she said, try to get these sampling, where you're going to sample, how you're going to sample, get that all put together ahead of time, and then repeat that. Don't change the next time you do it. So one of the things that we're not really sure of is how many birds do you actually sample? What is a representative subsample? You can't go into a house of 150,000 laying hens and measure every single bird. What do we do? How many birds should we measure that would represent the flock? Also, where do you get birds? Where do you actually sample the birds from? In a really complex environment like an aviary, birds that are experiencing different types of welfare issues may be in different types of the system. Maybe you have more birds who are lame on the floor because they're not really able to get up and down the system. Or maybe they're trapped somewhere on the system because they can't move off of that level. So where do you actually sample birds? What age do you sample? So we know with broiler chickens that welfare issues tend to get worse as they get older. So we oftentimes measure them from 4 to 6 weeks of age to try to capture what's going on with the flock. The later you measure, the less time you have to intervene. But the earlier you measure, it might be wasting time essentially because the results of your outcome are that the birds are all fine, which maybe that is a good thing to know. And then the other thing is, how do you take the sample? So do you catch birds? That can induce stress in a flock. So you can cause fear reactions like panic if you're catching. It can just be a bird being caught is very stressful to the bird. So it's sort of viewed as a predation event. Is that worth, you sort of have to measure, is it worth catching the bird versus the sort of results that you might get? Or can you use something like the transect method? And that's basically where you walk through a barn in predetermined ways, and you just look at the birds. But with transect method, you might not actually be able to see some of the measures you want to take, like foot pad dermatitis, for example, because you can't see the bottom of their feet while they're standing. Training. So it's really important to develop standardized training programs that people can use across the board. We sort of have a mishmash of places. So for instance, with keel bones, we have a few labs that really sort of specialize in keel bone issues. And so each of them have their own training programs, which differ slightly. Some use more x-ray based, some use more palpation based. And so really developing a sort of standardized training program so that we can really work through the welfare outcomes that we get and know that they're valid across different types of assessors. Improve consistency across studies. So again, developing these more objective type measures that have good training available for them will help to do that. Keep measures as objective as possible. Again, some measures are just inherently subjective, but we do our best to try to make them as objective as possible. And then we also need to design assessments for non-researchers. So researchers are oftentimes very well trained because these are the sorts of measures that we're taking all the time. But how do we then take those measures and put them in a form that perhaps doesn't require that really extensive amount of training? Or can we provide training programs for folks who are not constantly utilizing these types of measures? It's really important, but something that never really seems to happen is benchmarking. So particularly in North America and the US. So what is sort of normal in North America? We know from Europe, there's been more benchmarking. So we sort of know normal in Europe, but our systems and the way that we manage birds are different between the two continents. And so it's really important to know what's sort of normal in North America. And this also would help us to understand geographic differences. So, if you're in the southeast, where it's very hot and humid, you may have very different types of results because you have different types of management from somewhere that's, let's say, North Dakota, where it might be very cold for a long period of time. Benchmarking and understanding where do our birds fall in terms of their welfare outcomes really also helps to set realistic goals for producers. So knowing sort of where's the average, and then how do we get folks who are below that up to average, and then we can sort of move up incrementally in terms of having higher welfare. It's also really important to understand genetic influences. So benchmarking really helps us to look at lots of different strains that are used in production and understand how do they differ in terms of welfare outcomes. And then also understanding housing system influences. So we have lots of different types of housing systems. Lots of producers are now going cage free. And so what does that mean? And there's lots of different ways that you can house birds. You can get commercially available systems. You can build your own type of systems. I see a lot of home built aviary type systems. We need to know, like, what is the impact of these and what's the contribution of housing systems versus the contribution of genetic influences. And so you get results. So what do you do? What do you do with a welfare assessment? Well, you can use it to understand underlying causes. So let's say you have a lot of poor foot quality. You can then go back and say, okay, what contributes to poor foot quality? And do I have any of those issues that I can correct? We can use it as feedback for housing design. So maybe perches are in a poor place and you get a lot of injuries or broken bones because the birds aren't moving through a system in the way that we thought they would. We can use these welfare assessments to then go back and say, okay, is there a better way to design the type of housing that we have? And then also feedback for appropriate genetic lines. So maybe a particular genetic line does really bad in a particular type of system. Doing these welfare assessments gives you that type of feedback that you can then say, well, maybe we shouldn't be putting these types of genetics in this particular type of situation. We also really need to start developing standardized welfare assessment programs for all species of poultry. So we have chickens down pretty well, but we don't really have a lot of information in terms of ducks, turkeys, quail, pheasants, even ratites. So there's still ostrich and emu production, not very much, but it still exists. And I do get questions about welfare of all these different species and how do you assess it? And we really need to start developing ways. And there is some work being done, particularly with ducks and turkeys, and a little bit with game birds, to try to better understand how do you measure welfare? How do you assess welfare for those birds? So to sort of summarize, we need to continue to combine resource and animal-based measures. So we can use resource-based measures, but we need to also back that up with animal-based measures. And then, as Dr. Dixon also indicated, we need to really start focusing on how do we identify positive indicators of welfare. We're really good at measuring poor welfare. We're not very good at measuring good welfare. And so there are people who are working on that now, trying to understand what are measures we can take to look at positive indicators. Really, we need to continue to refine and sample training techniques. Benchmarking is really important to do. Use assessments as feedback, and then also expand assessments to other species. And that's all I had. This was intended to be a sort of quick introduction to welfare assessment. So you got some really good sneak peeks and some better detail before I came along.